Thank you. So my name is Karim Martinez, and I'm an Extension Family Life and Child Development Specialist. And so I'll be going first for our team. Karen Plawecki is our Extension Nutrition Specialist. And today we're going to be sharing about a webinar series trilogy that we provided during the pandemic. So it was called the Stress and Resilience in a COVID World. And so I'll be talking a little bit about the background and the program description, and then each of us will share a little bit, just a few highlights of the mental health and nutrition approaches. And then Karen will talk about the lessons learned and the impact. So I'll point you to the lower image. So of course, during the pandemic, everything was on Zoom, right? So that's our team, our initial team. And so at the beginning of the pandemic, just to let you know the context of how this all got started, one of our extension agents, Suzanne DeVos Cole, she wanted to provide a virtual program in her county on stress management. So she reached out to Diane Christensen, who you heard from earlier, who's also an extension agent. And then she reached out to me because I had inherited a stress and resilience program from a previous specialist, and we were both familiar with that program. And then I reached out to Karen because there was a nutrition component. So this all happened very organically. We knew we had to do something very quickly because so many people were stressed out. And what we decided to do, instead of just doing it for Suzanne's county, we decided to open it up statewide because really it just seemed like everyone was overwhelmed with stress. So because the pandemic went on a lot longer than we all had anticipated, we ended up delivering a series 3 times. So we did that first original webinar series, and then we provided a second one on coping with COVID burnout, and then a third series where we focused on ongoing chronic stress and also the stress of communities reopening. And when we did those 2 other series, we also expanded our team. So we included Lourdes, who you'll be hearing from a little bit later, and Beef Vela, who is another county agent. And with all of these webinar series, we emphasize the connection between mental health and physical health. So just to give you some examples of some of the skills that we taught, we talked about focused breathing, about mindfulness, about changing thoughts and attitudes, the importance of maintaining social connections. We also included information about eating healthy, about being physically active, improving sleep habits, and utilizing community resources. So in terms of the setup for each of these webinars, what we did is we created a website where people could register for the webinar. But then once we delivered the sessions, we would post the recorded webinars on that website, also along with the PowerPoint slides and additional resources. So it's just a one-stop shop where people could go for the recordings and the information. And this was very helpful to refer people to if they missed the program. So in terms of some of the mental health approaches, this slide shows some of the topics we covered. And, we started each of the series talking about the fight, flight, and freeze stress response. And then we provided tools and strategies to help people learn how to calm that stress response. And then for the second and the third series, we added just some general information about anxiety and depression, as well as grief and loss, because that's what participants had asked for from the evaluations from the first series. And then we were also not only able to talk about the importance of social connection, but we also supported social connections among the participants because we provided opportunities for them to share their experiences either by unmuting or by typing in the chat, and that was very effective. And then we also encouraged people to share the resources that they found helpful for them. So like I said, the trilogy included a variety of tools, strategies to build resilience. And this is just some of the mental health aspects, but I'll turn it over to Karen now to talk about the nutrition part. Thank you.
Okay, hi everybody. I keep this up here because I have occasional cough. That COVID, that picture of us with our Zoom shots, That was my COVID haircut. So it's like, anyway. All right. So I will be talking about the nutrition side of things. So I'll be talking about the importance that we tried to convey to everybody to make sure they stayed well nourished and well energized, well fueled. So I was trying to, keep your batteries charged so you can tackle those additional stressors and all these additional changes that you've been, because it was COVID, a lot of people had questions about the immunity side of things. So I basically showed up my plate with all the nutrients over, and every food group had something that was related to helping your immunity. So I said, so let's get rid of the nutrients and let's just focus on food. And so then we just basically tackled, sorry, which one? Where did I, sorry.
Oh, here.
Where did I part?
I can do that for you.
That'd be great. Okay, thank you. So I was not the tech person. She actually was the tech person. So that's kind of funny. So anyway, so I'm just going to highlight a couple of the points. I covered more than this. I'm happy to talk about it later. So the fruits and vegetables, upper left corner, that was one of the biggest hurdles for a lot of people was how do you, even in best of times, how do you get your fruits and vegetables? So we talked about tricks and tips and ways of sneaking it in. And then also looked at menu planning overall for my plate. And then that's another way of kind of working in your fruits and vegetables and how to different ideas. And opened it up for the chat, and people had some really creative approaches on how to fit all this in and what worked for them. So that just added to some ideas that where people can then see and what would work for them and choose that. The apple is more significant as we looked at, we wanted to look at physical hunger versus appetite. And so the apple test, which is actually taken out of disordered eating and eating disorders, is getting people more in touch with, are they really physically hungry? And so the apple test basically goes, oh, I'm hungry, and you go to the rest, and you go to the refrigerator. And then you stop yourself and you ask the question, what if somebody said, I have an apple for you? And you're like, well, no, I don't want an apple, I want that chocolate cake. And then you're like, well, then you're not hungry. You want chocolate cake. And that's fine. If you want a chocolate cake, have the chocolate cake, but it's not because you're hungry. So identify, why are you going for that chocolate cake? Are you bored? Are you stressed? Are you fearful, angry, anxious? Whatever that reason is, identify that reason. And then we discussed a lot of other much more helpful and effective options versus the cake. And don't worry, we talked about how to work in cake and all that, because I'm not, when somebody's under stress, you don't pull chocolate cake. So, okay, go ahead. Oh, I'm sorry, go back. Sorry, I forgot the other two squares. Sorry. And then similar to, Neva, Deva, I'm sorry, I forgot your name. And so with the intuitive eating, we did do the hunger satiety scale just to get back to people thinking about internal cues versus external cues. And so that way they're keeping them, oh, thank you. Okay, I can do it. So thinking about making sure they eat when they are little, before they get too hangry, and then before they get too uncomfortable, stop. And then ultimately we moved into the third session, we moved into transitioning over to the intuitive eating approach, and we did the whole thing. And then not mindful eating, so that way if you're gonna have something you really enjoy your food, turn off your phone, put down your phone, turn off the TV, and so you can savor things. And also watch for your internal dialogue and no shooting on yourself. So if you didn't eat all your vegetables, you don't shoot on like, I should have had my vegetables. So watch for your internal dialogue. Okay, go ahead. All right, so next one. All right, so quick lessons that we overall learned was that we found out that, because it had to go online, that we could create an online community. The participants were amazing with how well they provided ideas, thoughts, encouragement along the way. When somebody shared they were struggling in the chat, people were just jumping in. It was great. And we got so many more ideas and suggestions from the participants. So it was really, really useful. And some of them were regional for different parts of the state that would work for people in that state. It was very helpful. Really just brought it up. Oh, is that my 1 minute warning? Okay, that's okay. It's okay. I can do that. Okay, so here we go. And then we used, as Karim was saying, we used a variety of tools. So in both with Zoom, so the discussion was huge. Discussion and chat was very huge. But we also did polling. We did simulations. Diane did a guided imagery We had videos just to kind of break up, so it wasn't a, look at your computer screen and just a lecture. It was very active and very engaging. And then we also wanted to reduce people's stress. So we wanted everything working really well. So we all had our roles. We met beforehand, made sure everything was loaded up properly. And then we had a greeter, that was Karim. And then we had somebody monitoring chat, or at least one person monitoring chat and interrupting the presenter as they went, so we didn't have to worry about it. Somebody, because the polls, I'm not sure, polls on Zoom are not really intuitive. But, and then the bouncer, so that was probably me, because I think it was a bouncer. And it's basically letting people in, muting their microphones. With New Mexico, we don't have with our broadband, we just want to make sure that everything was working, and muting the video. And then we bounced them out. It's like, you can't stay here, but you got to go. You can't go home, but you can't stay here. Whatever that word phrase is, whatever. Okay, so sorry, one more. And then so we had a really wide reach into Texas. And then we just had a nice regional thing. It was great. It was so much fun. And then at the end, and then we had 92%, basically people had increased their self-efficacy in one of the areas based on the coping skills and strategies that they learned from either us or from their fellow participants. And then it shows that extension is well equipped and can dive in and handle something very, very quickly and get something done. And let's go. And then if you want to see the slides or resources or the webinars, they're at family.nmsu.edu. Thank you very much.
Forgive me if you adjust this, but if you were going to do the series again, kind of in the phase of, I guess we're not in the pandemic anymore, but what would you change, if anything, if you were going to kind of reproduce it?
Well, I'll start. That's a good question. We're actually looking at adopting this for chronic stress. And so that way we can then turn around. So whether somebody's under financial stress, relationship stress, job, employment issues or whatever. So we're trying to convert that into a much more of a condensed version. From an online standpoint, I think we need to make sure we have adequate time. The first time we did this, the physical health side had way too much in there, so I ran long. So I would probably adjust that a little bit, and that's one reason why we added more weeks. So, but that's just due to time. We had to get something going. But we also, in the other sessions, we talk about habits, forming habits. We added sleep in the mid-series one. We added a whole session on sleep, which was really very helpful. So I would probably make sure we at least include sleep as well. That was part of the physical health one, but I just didn't have enough time.
I was doing this.
Yeah, I didn't do it. No, it was my first session. I just didn't do it very good. Do you want to talk? Do you want to add? No, something?
Thank you for your presentation. I'm Macy Helm with University of Nevada. I'm curious, did you do any long-term data collection to see any sustained, I guess, coping mechanisms, since obviously the pandemic went on longer than we thought?
No, so we didn't end up doing long-term, although from series to series, we did have by word of mouth. So it actually increased a little bit because people who had attended our first series, so we ended up with regulars. So again, it was part of that building connection, building community. So that was very helpful, but no, I think, and maybe we could do that. Maybe that could be for the next step is go back, because we do have all of the emails and everybody's contact information who participated. So that's an excellent idea. Thank you.
All right, a round of applause. Thank you. Thank you. We're coming in full force today from New Mexico, aren't we? Again, my name is Lucinda Benegas Carrion, and this is Lourdes Olivas, and we're from New Mexico State Extension, which is located at main campus of New Mexico State University in Las Cruces, New Mexico. And so the program we're introducing today is our Fit Families program, and it's been around and through different iterations over the years since I think about 2004. It's gone through many different changes, but right now this program is focused in southern New Mexico and is really focusing on delivering to some of our most at-risk communities. So right here we have a 12-week program, which is a healthy lifestyle program. We wouldn't necessarily call it a lifestyle change program. What we're trying to do is bring in families with children who are between the ages of 5 and 12 years old. And as soon as we find out whether a family has at least one child within that age group, we invite the entire family to join us. And so this could include, different variations of what family is. It could be parents, siblings, small and older, it could be grandparents, aunts and uncles, and sometimes they bring along some friends. And so basically, our sessions are about an hour and 45 minutes in length, and our curriculum is available in both English and Spanish, and we mostly do them face-to-face, although during COVID, we did switch to an online model, which posed some challenges for us, but we had to work through them, and then we adjusted back to face-to-face as soon as we could. For our facilitators, and I'll get to the curriculum and what that involves here in a few minutes, but for our facilitators, we really focus on university faculty, which could be us. We're extension associates. We also have backgrounds in kinesiology and physical education, as well as public health. And then we also work with some of our kinesiology professors who bring in interns to help with the physical activity portion of our program. We also rely on community health workers, which in our area are considered promotoras, as well as dietetic and public health interns and community partners. And we find that working with our interns is really important because it gives them hands-on community-based experience, something that they might not otherwise get in a school setting. And that's always really important for us, and it helps keep us sustainable. Our funding is provided by Blue Cross and Blue Shield of New Mexico, and we've had that great opportunity through them for the last 5 years. It's going really strong. We're able to create some partnerships with that, and they bring us into various different promotional events that we can participate in, and it really just helps us, get the recruitment that we need. And so going into the next slide, let's see, yeah. So this is our kind of referral process. Mainly the group of us that we usually have that come to our programs are self-referred. They hear about our programs through community events or sometimes through the schools and social media. Sometimes we get providers or school nurses who refer to us as well, although those come a little bit far and few between. For families who want to participate, we usually take between 8 and 12 families, which could equal up to about 40 people in a class. And so that can be actually really beneficial because we get to meet a wide range of people, but it can also be challenging due to the specifics of the location that we have, or also just due to, working with the number of people that we do. Our enrollment forms, we go through registration, demographic forms, informed consent. We want to make sure they understand that they have the option to participate. They can, back out at any time. It's really up to them. And we don't make any of the requirements mandatory for participation. We want them to do the physical activity. We want them to do the cooking, but we want them to also be comfortable with what we do. We have pre and post evaluations, which mainly really focus on whether families increase their knowledge base on healthy eating, as well as increased fruit and vegetable consumption. And then we also have participant agreement forms and expectations that really just focus on saying, if you're going to come, we really want you to participate. We want to make sure that we're all having a good, positive moment and time here with our program. Implementation requirements can be difficult. We usually like to use our university campus. We have access to lots of rooms. We have access to a really nice kitchen, and it's great. We have all our equipment there and it all rolls out really nicely. However, sometimes we are put into the community and we're given challenges such as not usable kitchens. We're giving really small spaces to work with the number of people we need to assist with, and it can become challenging. However, a lot of our facilitators are really good at switching gears. They're able to make those adjustments as needed. We also provide reinforcements for the kids and parents for every class. That could be water bottles, it could be cooking utensils, and sometimes physical education materials. And that's always really important for us to help get them to say, you can take our information home and you can actually go and do it with your family and not just here in our program. Attendance and graduation is really important for us. We want them to attend at least 9 classes of the 12. We realize that life happens and that's, okay, but we want them to know that we're here for them when they're ready to participate. And then we have a really nice graduation there at the end. So for our curriculum, I just kind of want to point out that what we're focusing on is a couple of things. They come in, they get to participate in a about 20-minute healthy cooking lesson. So we have a recipe that is set amongst stations, and then we actually have ingredients that are there for the participants to actually work with and actually provide the meal for their families. So there might be some level of cutting, fruits and vegetables, or measuring out certain ingredients. And it's all part of just kind of really getting families to work together towards cooking a healthy meal. And then we also have a nutrition component where we are teaching them nutrition. We're teaching about portion sizes and, also about, again, an aspect of intuitive eating. And we're teaching them how to make better choices, obviously, between, what could you eat instead of this high sugary processed food? A better option could be this. And then we're also including a physical activity at every class, which could be about 20 minutes. Again, these are cooperative games, which are really meant to incorporate the entire family, so that way they can learn how to do these activities on their own at home. We have a mental health piece, which Lourdes is going to cover here in a few minutes. And then again, as most of our other programs all kind of follow, we have a SMART goal setting portion of it. And for those, we're focusing on the 3 areas down below: healthier eating, getting active, and feeling more positive. Because what we know is that when you're working with a family, it's really important to engage the whole family so the kids can have, just a more positive experience overall. I will pass it to Lourdes.
Okay. Hi, so I'm Lourdes Olivas, and so the next component is the mental health. So Lucinda talked a little bit about how we've had some revisions, and so during the pandemic, our funders had kind of asked us a little bit about what more are you doing around mental health? We had a mental health piece, but it was more on mindful eating and just having a positive self-esteem. So with the pandemic, we saw that, our promotoras, our families were talking a lot about depression, stress, anxiety. So we went ahead and worked with a clinical licensed social worker who was also at the time our FCS agent in Doña Ana County. And we added all of these topics here since this is where a lot of people were showing that they needed more information on. So we did emotional coping, bullying resiliency, communication with respect, conversation starters, mistakes and positive discipline, stress and anxiety, family relationships and why they're important, and then dealing with grief and loss. So Lucinda mentioned working with promotoras. So that started in 2018. We started that collaboration with promotoras, or also known as community health workers. And we've trained 9 since 2018 that go and help us with delivering the program, recruiting, looking for locations. And so they have a huge footprint in their communities. So we've also seen an increase in recruitment. We have families that are wanting to come and participate in this program. And with that, we've had an increase in retention. So we have over 90% graduation. So these are families that haven't missed more than the 3 classes that they're allowed. And a lot of them actually won't really miss any because they value the person that's facilitating the program, which are the promotoras. And then so we've also been able to have long-term sustainability. So we've actually, with our funding from Blue Cross Blue Shield, we've been able to offer sometimes an extra series of the 12-week program. So some of our expectations and outcomes that we want. So like I said, sustainability, we've had extra funding sometimes left over. So we've been able to secure a couple of veggie meters. I don't know if anybody's familiar with those. So we have those in New Mexico, and we've been using them with Fit Families. It's just an awareness when families see their score, whether it's good or bad. And so then they want to see that post, and they want to see a better outcome. So, they're increasing fruits and vegetables in their diet. We've been able to make additional partnerships with our promotora. So we just finished a series this summer at Jardín de los Niños. This is a nonprofit organization. One of our community health workers actually works there and was able to recruit families from there. So this organization serves families that are near homeless or homeless. And so we were very fortunate to be able to provide this program to that community. Increased physical activity minutes. So it's something that we do in our evaluation. So we've seen people actually adding more minutes of physical activity. As I mentioned, fruits and vegetables. So kids are adding more fruits. And then in our meals, we try to introduce fruits and vegetables that aren't commonly eaten. So that way they have that opportunity to try something new, and they're not having to go to the store and spend money on something they're not sure if they're gonna like or not. So that's been something positive that we hear from families, like, oh, this is really good, I'm gonna add it, I'm gonna go buy it. And then again, increased knowledge of some healthy food options. So since we've added more around mental health, we've seen an increase in discussion around mental health, and it's taking that stigma away a little bit from, should my child go see a therapist? So especially in the Hispanic community, there's a lot like, no, I'm not going to have my child go see a therapist and, share their problems and stuff like that. So there's been a decrease, some are a little bit more open now that we've added more around mental health. And then just being able to deliver to underserved communities with the help of promotoras. We can go in there and try to recruit. We'll be lucky if we get like 3 families. But with promotoras, they're trusted. And so we have families that are going to be more inclined to participate and sign up for the program. So since working with promotoras, and not just promotoras, as Lucinda mentioned, we also do classes utilizing our community health worker interns that are in public health, our dietetic interns. So they'll go out and recruit as well. So we've reached 75 families, both English and Spanish. So that approximates about 200 youth, 125 adults within just the last few years. And that's our contact information.
Presentation. I love the emphasis on the important role of promotoras in your work. I was wondering, what has been your experience with how you recruit the promotoras and how you make sure that they're people trusted by the community?
So did you ask how we recruit?
How you recruit the promotoras and sort of making sure that they are people who are trusted by the community.
Okay, so a few of the promotoras that we are using for Fit Families, I've already had a collaboration with them with another program that I oversee since 2012. But in Doñana, there's like a network of community health workers. So in 2014, they started working on having the license for community health workers in New Mexico. And I think that passed through around 2014, 2015. So there's that listserv, but a lot of them are just also referred by other community health workers. So when they know that we're looking to train a couple new ones, they'll be like, oh, I have some individuals for you. And so sometimes we'll meet with them, talk with them. We've had a few, not very many, maybe 1 or 2 that just didn't work out because they don't have that experience in community delivery of programs. Their experience is in something different as a community health, as a promotora. So it's not really community health, it's in something else.